Hello, uh, this is Professor Yamini Bhushan Tripathi, former Dean Faculty of Ayurveda, and I am interacting with all of you under the certificate course of palliative care through integrative approach. And today I am going to discuss about stress and burnout. You know, everybody knows what is stress, but the burnout is not very common. We have to understand the difference between stress and burnout. Okay, stress may be acute, but burnout is very chronic, and burnout is difficult to manage. That's why, as a palliative caregiver, you should know what is the stage of your patient or of the family who is the caregiver, first line of caregiver. So, stress and burnout in palliative care and mental state in old age. First of all, we must know that mental state in old age. Old age, why I have taken here? Because most of the chronically ill patients are elderly patients. And in that case, this factor is also very important and this should be taken into consideration. In patients of geriatrics or those who need palliative care, there is a feeling of hopelessness. Hopelessness is a very important factor in elderly and in chronically ill patients, both. They lose the meaning of and purpose of their life. Due to isolation in family and society, they slowly start developing symptoms of stress and ultimately get converted into burnout. This is a gradual step. This first step, then burnout. Why stress comes? Because hopelessness, because isolation from the family, because isolation from the society. So everything is gradual. First, they became old. Secondly, they got sick. Thirdly, they got isolated by the family members, friends, relatives, and then they started feeling stress and burnout. The social implication, it can strain peer relationship, reducing collaboration and opportunities for support. And personal consequences, personal well-being suffers, leading to health problems and decreased life satisfaction. The consequences of stress and burnout, we are going to understand the difference between and what is the classification. You see, this is the symptoms of stress. This is the symptom of burnout. Read it very carefully. What is the physical symptom? Headache, muscle tension, and fatigue. In the burnout, chronic exhaustion, frequent illness. This is the burnout stage. Emotional irritability, anxiety, and mood swing. Here, detachment, feeling of empathiness, cognitive difficulty in concentrating, forgetfulness. This is a stress symptom. In the burnout, cynicism, cynic behavior, and lack of motivation. Okay, and behavioral restlessness, overeating, sleep disturbance. These are the symptoms of stress. And in burnout, withdrawal, reduced productivity. You can see the symptoms are different. When your patient is showing this kind of symptom, you should understand that he is in the stage of burnout. If these symptoms you observe, you can understand this is a symptom of stress. Psychiatric tools for stress and burnout. First of all, meditation, medication, medicine, neuromodulation, sleep regulation and therapy, stress inoculation training, SIT. There are 4 methods of management of stress and burnout. In medication, selective serotonin reuptake inhibitors, SSRI, anxiolytics, mood stabilizer for severe cases. This is the group of medicines which are used in managing the stress and burnout. So, anxiolytic means those drugs which reduce anxiety and induce sleep. So, sleep is very important, as you know. Ahar, Nidra, and Brahmacharya. There are 3 important pillars. So, sleep is very important. So, neuromodulation techniques like transcranial magnetic stimulation for treatment-resistant cases. Those patients who are not responding to medicine, for them, this kind of intervention is applicable. Neuromodulation by TMS, technique like transcranial magnetic stimulation. Third stage comes sleep regulation, targeting circadian rhythm to improve sleep and reduce stress. Okay, and this is a holistic approach, sleep regulation. It can be affected by Ayurvedic method, it can be affected by yoga, it can be affected by naturopathy. We will discuss it in the coming slide. Stress inoculation training. What is this? Gradual exposure to stressor with coping strategy development. First, exposed to stressor and then coping strategy development. You start how to cope with that. So now this is a figure for easy understanding. Decrease of discontinuous caffeine. Excess caffeine, tea and coffee is not good, induces stress. Regular exercise and adequate sleep is very important for management of stress. Relaxation and meditation and pacing. Pacing means give time to your body, mind. Work, leisure, balance. Work and leisure. You should have free time also. Continuously working is not good. It will always create a stress. So during the work hours, some leisure time should be allocated. And realistic expectation. You should have a realistic expectation. You are working for a goal, for expectation. But very high expectation will give you stress. So first of all, when you are working for a goal, fix up it. How much you can do easily, and depending on that, you should work. And last is the reframing, belief system, support system, and humor. Reframing of your mind conditioning should be in such a way that it should not induce stress while working. What are stress and burnout? This is a picture very important. Stress means a response to external pressure causing physical and psychological strain. External means something in your surrounding, in your working place, in your home, which is causing you stress. This is called the stress trigger. Burnout, a state of emotional, physical, and mental exhaustion. You are completely mentally exhausted. First, you get exposed to external factors, which gives you stress. But if it persists long time, you completely exhausted, mentally exhausted. You lose all the hope. Look, nothing can happen. I have to live with this condition. That is the condition of burnout, caused by prolonged stress. Prolonged stress causes mental exhaustion, and that is the condition of burnout. So, key difference: stress is a short term reactive for what? Reactive for external pressure, whereas burnout is a long term and cumulative effect. You understood the difference? Stress and burnout. Stress is acute and reactive, and burnout is cumulative and long term. So, understanding stress. Stress is a response to external pressure and demand exceeding the resource of that individual. If the external pressure is more than your resource, individual resource, then you will go under stress. It is potentially harmful due to physical or environmental factors. Keep in mind, it is potentially very harmful. In palliative care, stress can arise from patient interactions, emotional challenges, and workload. Suppose a man is not able to do his daily work, and he is not getting any helper for the day-to-day functioning. He feel like a workload. He feel like a challenge of the life, and then he start getting stressed. So, what is the duty of palliative caregiver? That he should support the patient in such a way that he should not feel any workload for day-to-day work. He should not feel any emotional challenge and patient interaction. These are the things he can take care of it. Now, what are the stress factors? Situational variations. Situational stressors include factors like duration, severity, predictability, and controllability. Can you control it? Can you predict it? What is the severity? What is the duration? The impact of these variables define the nature of the stress experienced by an individual. So all the four factors are there. How severe it is, how long it is, can you predict it, and can you control it? Four factors. The common stressor triggers encompasses major life changes, work-related fatigue, financial issues, personal conflict such as family problems or divorce. These are the some of the examples which are the cause of the stress. They induce the trigger. They are the trigger of stress. It may be related to work, it may be related to your family, it may be related to financial burden. These are the things you should do. The early symptoms of stress, physical, I have shown you earlier, headache, muscle tension, fatigue, emotional, irritability, anxiety and mood swing, cognitive, difficulty in concentrating and forgetfulness, and behavioral restlessness, overeating. Overeating is also a symptom of stress, and sleep disturbance. The type of stress, this is also important, you should know. Acute stress, chronic stress, episodic acute stress, traumatic stress, and psychological stress. What are these things? Acute means short-term stress in response to immediate threats. Example, examination, work deadline, sudden danger. Chronic stresses, stress means long-term stress due to ongoing problems, persistent challenges affecting your health. For example, financial difficulty. If your salary is not enough to feed your family, you are under financial challenge, getting stressed. Strained relationship. If you are not having good relation with your family, with your friends, with your colleagues in the department, you may have the chronic stress because you cannot change this position. You have to work in that environment. That will induce a chronic stress. Acute means examination has come, it has passed, the challenge is over. But chronic, you cannot change the environment in which you are living or working. Episodic, frequent acute stress episodes leading to anxiety. For example, highly anxious individual, type A personality. I will discuss in the coming slide. So highly anxiousness is also creating acute stress. And traumatic stress, stress due to extreme life event. For example, if you have participated in a war or in an accident or in some abuse, these kind give you traumatic stress. And psychological stress from social and environmental factors. Example, social isolation, discrimination, workplace conflict. These are the psychological stress. The consequences of stress, physical, headache, muscle tension, and heart disease. This is very important. Cardiovascular disorder is because of stress. We have to manage it. There is a complete biochemical network between stress, hormones, and heart disease. And psychological anxiety, irritability, and memory problem. Your cognitive behavior will start changing in due course of time, and you will start loss of memory in a very early age. That is not good. And behavioral means poor sleep, unhealthy habits, and social withdrawal. You keep want to be live in isolation. You don't want to interact with people. This is a behavioral change you get in this stress. So link between mental stress and palliative care. Now we are all learning how to do palliative care. So now what is the link? Why mental stress matters in palliative care? Chronic illness and terminal diseases due to high psychological distress causes highway. Patients may experience anxiety, depression, and emotional suffering. Family caregivers also undergo psychological stress. The patient and family both are under stress. So, as a palliative caregiver, your role becomes very important. Role, what will be your role? Psychological support, counseling, and therapy for patient and family. You have to do counseling of the patient and the family members, and if needed some therapy, you can recommend. Pain and symptom management, reducing the physical distress, lower the mental burden. If some symptoms the patient is having, if you reduce it, his anxiety or stress will be reduced. Spiritual care, help patient find meaning and peace in life, meaning of life, why he has come on the earth, what he has to do, what he has done. These are the spiritual feelings you have to talk to them. Patient listener, I told you earlier classes, you have to be patient listener. And you should understand the psychological status of the patient. Then only you can give spiritual healing, social healing, or any type of counseling you can do. So we have to understand the psychology of the patient. And social support means community involvement to reduce isolation. You should invite people who are known to your patient, your family members, relatives, or anybody else. Then social support to the patient is very important. And mind-body intervention. You should induce a method of meditation, relaxation techniques, and stress reduction therapy in your patient. Now, the second issue is the burnout. Types of burnout. Overload burnout, driven by excessive work demand and ambition. If you are very ambitious and very highly involved in working, you overload. Don't overload yourself, otherwise you will lead to the burnout. Under challenge burnout, due to boredom, lack of growth, and monotony. If a monotonous lifestyle, lack of growth in your career, or you're feeling boring in your lifestyle, that will ultimately, because it is a chronic condition. I told you acute stress and chronic stress. It leads to chronic stress. And neglect burnout, result of feeling helpless, incompetent, and unsupported. This kind of feeling, if you develop in your life, you are going through a case of burnout. Early symptoms, I have already told you, chronic exhaustion and frequent illness. Frequent illness is very important, physical. Detachment and feeling of empathiness, cynicism, lack of motivation, and withdrawal, reduced productivity. These are the symptoms you should observe. What is the consequence of burnout? Emotional exhaustion. Emotionally, you are exhausted. You see the picture, he is crying, feeling drained and fatigued. Depersonalization, cynical attitude, detachment from work. And the last one, reduced performance, decreased productivity, and lack of motivation. These are the consequences when the patient is burnout. He can be a young man, he can be old man, but this burnout can happen anytime. You have to be very careful about it. The cause of burnout in geriatrics and chronically ill patients, broadly, it includes physical factors, psychological factors, social factors, and medical factors. Physical factors, chronic pain and fatigue, because he is a chronically ill person, declining mobility and independence. He is dependent on somebody for day-to-day work. His mobility is compromised. That is the problem. Physical. Psychological, depression and anxiety. Because of hopelessness, because of the treatment is not effective, the disease is persisting, he gets depressed and under anxiety. What will happen to his future life? This kind of feeling comes. Feeling of helplessness and fear of death. This brings depression and anxiety. Social factors, social isolation and loneliness. Loneliness, most of the time, elderly, chronically ill people live in their room. Nobody is talking to them. Nobody has time to interact with them. So that case, the social factor for the burnout. Loss of loved ones, support system. The support system has been lost. Nobody is there to help. And medical factors also. Repeated hospitalization. Patient is going every time to hospital to visit doctors. Invasive treatments. Some drip, some ICU facilities are going on. These things are not good. Poor communication about the prognosis, treatment options. Management of burnout in palliative care. Pain symptom management, emotional and psychological support, spiritual care, social support, mindfulness and relaxation technique, and personalized care. These are the things which you can personalize, modulate from person to person, how to manage the base care. So I've told you that the medication one, counseling, helping patient find meaning and purpose of life, there is spiritual, encouraging family involvement, that's very important, meditation and breathing exercises by yogic practices, and respecting patient preference and autonomy. That's a personalized care plan. And psychotherapy for stress burnout. What is psychotherapy? Cognitive behavioral therapy, CBT, identifies and modifies negative thoughts pattern, enhances coping mechanism. This is the CBT. Counseling provides emotional support, stress management, strategies, and guidance. Mindfulness and meditation, this improves emotional regulation, reduces stress via present moment awareness. We always say mindfulness means whatever you are doing, your mind should be involved, completely engrossed in that. Mindful eating, mindful sleeping, mindful working, everything mindful. Your mind should be in your work. लोग कहते हैं अपने प्रेजेंट में जियो. प्रेजेंट में जियो मीन्स जिस लाइफ में हो उसी तरह से सोचो. रह रहे हैं यहाँ बैठे हैं सोच रहे हैं कुछ और, तो दैट इज क्रिएट एंग्जाइटी. दैट यू शुड नॉट डू. माइंडफुल action is very important. And last one is biofeedback. Use physiological feedback to control stress response like heart rate and muscle tension. Biofeedback mechanism is completely defined scientific tool and psychiatric tool for stress and burnout. Medication, neuromodulation, sleep regulation, and stress inoculation training. Now I am talking of personality. You see, personality theories, there are two theories very common. Big 5 personality traits, Ocean model, and MBTI personality types. What is this? Openness, OCEAN model. Openness, creativity and curiosity. Consciousness, discipline and organization. Extravagancy, highly social and highly energetic. Agreeableness, kindness and cooperation. And neuroticism, emotionally instability. These are the 5 type of people you will find in the society. Another classification is 16 personality types based on introversion versus extroversion. Introvert and extrovert personality, we always use it. Introvert means a man who is always involved in himself. He is not thinking about others. Extravagancy means he is more towards extravagancy means the extrovert, number one, and extravagancy means excess expenditure he is doing. That is a type of personality. Sensing and institution, thinking and feeling, judging and perceiving. This is a different classification prescribed by the psychologist. So based on that, I am coming back. Type A personality, which I have talked about, competitive, ambitious and impatient. This is type A. High sense of urgency and stress. Workaholic, always working. Very competitive and ambitious. And increased risk of heart disease. This is type A. Other type B, relaxed, easy mood, easy going, patience, no hurry in his life. Type C means suppresses emotions. This is also cause of disease. Suppresses emotions. He is not able to express what he is feeling. Detail oriented and perfectionist. He wants everything perfect. That is also a kind of personality which causes the disease. Type D means prone to anxiety. A little problem will cause him anxiety. Pessimistic. He is not hopeful. Everything is pessimistic. Optimistic and pessimistic. He is pessimistic and avoids social interaction. So these are the personality A, B, C, D. And this is the classification I told you. And now, personality type and their stress response. Type A, competitive, aggressive, high. Common stressor, work pressure, deadline, lack of control. Stress response, anger, frustration, overworking, and risk, hypertension, heart disease. Type A person is more prone to hypertension and heart disease because of their personality. Type B, relaxed, flexible, and social. What will have? Mild anxiety, obesity. They will have obesity because they are not in hurry. They are relaxed all the time. Avoidance, procrastination, lack of stimulation, boredom, isolation. This is the common thing. Type C, emotional conflict, criticism, lack of control. What will they will do? Cancer, autoimmune diseases. They are more prone to it. And type D, negative, anxious, socially withdrawn. What the depression and cardiovascular disease. So these are the risks. So type A, type B, I have told you. I'm going with that. Thus, by assessing the personality trait, personalized treatment plan can be designed in patients of palliative care to improve their mental resilience, emotional well-being, and overall quality of life. This is the take-home message. If you know the personality of the patient, then you can personalize care can be managed. Now, what is the sign of burnout? Burnout is physical, emotional, and mental exhaustion. I told you this is a chronic condition. There is a physically exhausted, emotionally exhausted, and mentally exhausted from prolonged involvement in demanding situations. It is manifested through exhaustion, cynicism, and inefficiency in professional roles. So, emotional and physical effect, it can lead to anxiety, depression, and physical issues like fatigue, impacting caregiver well-being. So, burnout factors, just I'm repeating it, burnout stems from role of overload and conflict, often exhibited in a healthcare setting. Long hour professional isolation and unreciprocated effort contribute significantly to the burnout. And role characteristic, key trait contributing to burnout includes perfectionism and being a workaholic. If you are very perfect, want everything in perfect condition, no plus minus, and a workaholic, you are bound to get this kind of situation. Those traits can worsen burnout symptoms, leading to decreased performance and satisfaction. So, dimensions of burnout. Three dimensions have been defined. Emotional exhaustion reflects feeling of being drained. Personal accomplishment is the sense of effectiveness, and depersonalization involves detachment from the patient. Healthcare context. In healthcare, burnout dimensions can be particularly severe, affecting the quality of care delivered and leading to higher turnover rates among professionals in the field. The role of different personalities. I have shown you personality A, B, C, D. The influence of personality trait. Personality traits such as type A behavior, perfectionism, and workaholism make individuals more susceptible to burnout. Recognizing these traits can help in preventing uh, strategies. So, once you know what is the problem in your patient, what is the personality type, then you can understand the cause why he is feeling so uh, embarrassed. Then you can make a particular method through which we can have better quality of life. This is the take-home message. Now, ultimately, I am coming to the end. Chronic illness and burnout, the hidden struggle. Understanding burnout in chronic patients, the long-term illness leads to sustained stress and emotional exhaustion. So, patients with the chronic disease often experience social isolation, financial strain, and dependency, contributing to mental fatigue. And many patients enter palliative care already in a state of burnout. If a patient is already in a state of burnout, then it is very cautiously you have to manage how to take care of the patient. Intervention. The key factors leading to burnout: persistent stress, loss of control, emotional exhaustion, and personality trait. Type A and type C personalities may internalize stress, worsening the burnout. So, palliative care services, it can be OPD or IPD or community-based outreach program. Variant clinics, complicated grief, major depression, geriatric and frailty clinic, dementia and frailty, pediatric and adolescent palliative care, and teleconsultation-based home care. So, palliative care can be in any of these forms. It is not necessary that the palliative care giver should always be with the patient. So, depending on the situation, things can change. The OPD services include pain clinic. Main is the pain clinic. by using all transdermal, subcutaneous, oral, sublingual preparations. And the lymphedema clinic means decompressive and manual massage therapy. Wound and stroma clinic means availability of all hydrogel, hydrocolloids and adjacent. Managing burnout in chronic disease patient, long-term history, revisal approach to deliver palliative care. So early mental health interventions before initiating palliative care. Stress proofing strategies like mindfulness, guided relaxation, and emotional release technique. Social integration, group therapy is very important. Virtual connections and pet therapy. You know what I recommend that in a chronically ill patients, suppose the patients of diabetes are there. So 10 people are sitting together in one hall and they're interacting with each other, they are getting better response. So nowadays, centers are being created where the people of the same kind of disease or same kind of personality should gather together and talk to each other. That is a very good therapy. Social reintegration is important for this. And personalized coping through generalizing and music therapy and spirituality tailored for personality. This generalizing means the patient should be allowed to write what they have experienced in their whole life. This release their stress because nobody is there to talk to them, but they want to express their emotions. How they can express? Either a patient listener should be there or they should keep on writing the things. This is very important. Thus, early psychological intervention, tailored stress management, and personalized coping strategies can be more effective in handling such patients during palliative care. So, application in geriatrics, because I told you most of the chronically ill patients are the old elderly people. So, CBT and counseling help addresses depression, anxiety, mindfulness and relaxation, reduces stress and improve cognitive flexibility. Medication monitor psychological drug effects to prevent side effect of elderly patient, and support group provides social interaction. So application in palliative care, the same thing. I have told you the CBT, pain management, medication, and family counseling. In hospice, the patient is in the deathbed. Spiritual and existential counseling helps patient find meaning and acceptance of their final days. He's going to die in 3-4 days. That is the hospice care. Pain and symptom management. Use multimodal therapy to maintain comfort and dignity of the patient. Therapeutic to touch and compassion. Encourage physical and emotional connection to reduce his anxiety. And psychiatric and grief therapy, very important, support both patient and families in coping with loss of and transition, because he is going to die in very few days. That kind of emotional attachment therapy is very important. Financial burden is one of the most important cause for stress. So medical expenses, first of all, a lot of money is drained in the hospitalization, doctor fees, medicine. So hospital visit, treatment and medication. And caregiver services. If you are appointing a caregiver, you have to pay per month. This is the rate in Varanasi, in high in big cities it may be more. So that is also a kind of financial burden. And non-medical expenses, transportation cost for frequent medical visits, dietary needs, home modifications, and medical supplies. All these factors influencing your palliative care, financial burden. The challenges and strategies. Financial challenges, I told you, because no insurance company covers this, so out-of-pocket expenses is increased. You have a limited pension, you have to survive in that. How you will do, you have to manage it. Limited insurance coverage for palliative care, and loss of income for family caregivers. This is mitigation strategies. Government and NGOs should support. You should connect your patient to the government organizations and to the NGOs who are taking care in this situation, and seek support from local non-profit and community groups. There are always such a philanthropic attitude having persons in your society. Take help from them. advanced care planning. Discuss and document care preference to manage cost. I mean, what is the preference of the patient? What is the immediate need? You should target that rather than targeting everything together. Pain management is number one because he will feel comfort. After that, what else you have to decide? And finally, affordable care options. Design a care plan which is affordable to the patient. Otherwise, what will happen? He will have further tension. This is not good for your patient. So this was the take-home message. Thank you very much.